Hi guys, I'm Dr. Iraniha. I'm a board certified general surgeon, and I have been in practice over the last 2 decades in Southern California, Orange County, Newport Beach area. My main interest is minimally invasive surgery, including robotic and laparoscopic operation, and my main focus of the practice is major and complex abdominal wall hernia repair and body contouring. The videos that you're going to see is my experience through bilateral knee replacement. Unfortunately, I have developed bilateral knee arthritis and is associated with the pain and discomfort, and I need to have this type of operation in order to recover and go back to my normal life. And I thought it would be very interesting for people to hear and see my actual experience through this operation for multiple reasons. Number one, it's because of my unique age group that I'm going through this operation. Number two is that I'm going through bilateral knee replacement, and I watched so many videos on the social media, and I didn't see that many people with the bilateral knee replacements and sharing the experience, and I thought might be helpful. And the other last reason is that I'm a surgeon myself, and I deal with patients post-operative pain and discomforts and recovery, and I thought looking at this operation from a surgeon eyes and also a patient perspective might be very helpful, and that's why I'm going to share my experience with you. But again, I'd like to emphasize that I'm not an orthopedic surgeon, and I'm not a certified and licensed physical therapist. So whatever I say in these videos and what you see from my post-op recovery, including my pain medications regimen and also the exercises that I'm going to show you, are not a medical advice. If you have any question or concerns, you definitely need to talk to your orthopedic surgeon or discuss the matter with your certified and licensed physical therapist. Hi guys, today is day number 4 after my double knee replacement. Last night was a rough night again. I barely slept. It was tough to feel comfortable with your knee straight, and I was unable to go side to side, and that's why I had some back issues and back pain, and it woke me up multiple times throughout the night. And but this morning when I woke up, I felt better. Those episodes of chills and low-grade temperature that I had made me very nauseous and uncomfortable, and I felt very weak, tired, and lousy. That's almost gone. I'm feeling better today. I have a little bit more appetite, and I had another session of my physical therapy. My right leg is a little bit more swelled up compared to last 2 days, but the left leg is the same. The extension that I had this morning was a little bit better, was around 5 degrees, and my flexion on the left side was around 80%, which was similar to the last session, and right side, because of more swelling, it was around 70 degrees, which was less than before. But I know these things can happen. Obviously the swelling goes up and down, and I can see the swelling is spreading throughout my thigh and lower leg, but it's part of the recovery. I'm still icing. Those ice machines, they're helpful, but they're just extremely noisy, and
make you very uncomfortable when you hook to them. So I keep taking them off and put a ice pack on my knees. So I just took the ice pack out and wrapped my knee just to do my exercises based on my physical therapy session today. I had to do different exercises today, and I'm supposed to do that 3 times a day. So I'm going to show you what exercises I'm supposed to do 4 days after the surgery. So the first thing we're going to do is pushing the pedal and moving the ankle up and down, and then every time you do that, you can try to hold for 1 or 2 seconds, and that way you activate the your leg muscles and your calf muscles. So those are the things I'm supposed to do. And the other thing that I'm supposed to do is raise my knee and leave my heel on the table and try to flex my knee as much as possible, hold it again, and then push it down. And when you push down, you can extend your knee as much as possible and push the knee down to the bed, and that way you activate the quad muscle at the same time. So that way you activate the posterior thigh muscles or hamstring muscles, and also decrease the stiffness. So we do have to do that multiple times throughout the day, and then I do that on the other leg. It's tough because you have a lot of swelling, obviously, and then it's just the range of motion is very tough to do, and but I'm doing my best as much as possible. The other thing that I'm supposed to do is to just raise my knee a little bit and push with my heel down, and that again activate my posterior thigh muscles or hamstring muscles, and that way you keep them strong. Obviously there are a lot of muscles around your knee that helps for you to walk, and those muscles, they get atrophied very quickly after the surgery because of lack of movement and also a lot of swelling and trauma. But keeping them strong is very, very critical for post-op recovery. So those are all little exercises that we're supposed to do in order to improve the muscle tone. The other thing that I'm supposed to do is I'm supposed to dangle my knees and legs on the floor, and when I touch the floor with my feet, I bring them as much as possible back, so essentially flex my knees as much as possible, then gently pushing with my hand, my whole body. I'm just going to go into the front and essentially passively flex my knee a little bit, and then wait for a few seconds, and then just go back and relax again, and then do that multiple times, and that way again you increasing the flexibility of your knee. So that's another exercise that I'm supposed to do. The other exercise that I was told to do is to raise my leg and basically activate the quad muscles without moving your hip joint. So raising the leg and activating the quad muscles, and you hold it for multiple seconds, and then you bring it down, and then you do that in multiple times throughout the day. It's tough. Even though I was very flexible and I did yoga, but this is extremely traumatic surgery, and you get a lot of swelling, so you have to fight through these kind of discomforts and decrease range of motion in order to get back to your normal. So the last thing that I'm supposed to do is to stand up and whether on the counter or the walker, and do the leg raise and or calf raise essentially, so to improve the calf muscles. So that's another thing that I'm supposed to do. So those are the exercises that I was told to do as a second session of my physical therapy. Again, overall, I'm feeling a little bit better. Still, a lot of swelling, a lot of stiffness, and lack of sleep. Those are the main things that I'm concerned about. But hopefully, every day I feel a little bit better, and I keep you posted. Thank you.